Time for another edition of Wellness Wednesday with Dr. Bradley Meyer at the Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Good morning, Dave. Good morning, everybody.
This is going to be a fun topic. I'm going to like this one a lot because I think until several years ago, I think sometimes in life we just take things for granted. We just kind of get in the daily mode and we just take things for granted, and then, boy, boom, something happens. And with the onset of COVID and everything since in the medical world and in our own personal lives, healthcare-wise, pretty good time to do a little reflection.
Absolutely. And my sister Rachel, she's an ICU nurse down in Des Moines at Unity Point, and she got me reflecting a bit last night on the last few years, and she said, I just can't believe some of the things you've explored, discovered, and learned. And she described the whole lifelong protocol of medications without education on lifestyle modifications, change in diet, or alternative therapies. He said it's just wild because it helped my stepmom, and this is my half-sister, with some treatments that are a little outside the box with ozonated glycerin, dramatic improvement. And Rachel looked up some information on ozonated glycerin, and she's like, wow, this stuff is incredible. Why don't more people know about this? And so that got me thinking of the last 3 to 4 years again in my journey, and a lot of the journeys of us, whether or not you're in the medical field or not, you've been touched by health, wellness, or unwellness. And, I think the big thing that I came away with was to do better, you have to know better. And so it's a lifelong process of learning and to know better. And that applies to all the different things that I've implemented that weren't necessarily all taught to me in medical school. And again, we oftentimes talk about the prescriptions, pharmaceuticals, which have their time and place, and I still will use them. Surgeries, of course, when needed, are incredibly grateful. But there is this span in there when it comes to chronic disease and health and wellness and adding quality to every day that I think we can do a lot better with. And that's what we're seeing for folks that come to the clinic here, that they're able to do a lot better with, and they're not just going through the day. But it still surprises me. I live in this world. How many folks still don't know about that there is more if you've got pain than Motrin, or if you've got joint pain in a knee or a shoulder, there's more than just a cortisone shot in there to help. And with what I see with these therapies, my wish is that this and this is part of the Wellness Wednesday, mission is to get the word out so folks can have better quality in their life and can engage in their families, do the things they want to do, live with joy, and have that desire, that energy every day to get going and create and to feel amazing. And so, but again, when you're in that cycle as a physician, specifically 5-minute appointments, 30 to 40 appointments in a day, I can understand, and this is where I was at, why it was basically just putting out fires. High blood pressure pill, neuropathy, which is, we're going to talk about that now, is numbness, tingling, and oftentimes pain that can keep people up at night and cause balance problems, falls. That's in the hands and the feet. Many times feel that. And gabapentin was one of my go-tos. Gabapentin, Neurontin, Lyrica, and those things oftentimes didn't come without side effects. Sometimes they worked some to help curb the symptoms, but they really weren't working to, I didn't see dramatic changes, put it that way, with those things. And so I just think about, even in the case I had in neuropathy again, what is neuropathy? Neuropathy is pain. It's an inflammation of the nerve. And there are a lot of different things that can cause it. Lots of things. So, the tools that we've found beneficial for it when we started out was hyperbaric therapy. Many times folks really improved with hyperbaric therapy, and that's coming down to pressure and oxygen. Mm-hmm. And what happens is these nerves, they get injured, again, whether it's from high blood sugar, from diabetes, whether it's from some other toxin exposure. Sometimes it's idiopathic or the cause is never really found out. Mold, it can be gluten, so many things. But that nerve gets stunned, and it's kind of goes into the protection mode. And many times we think, well, we just take that pill to kind of just deal with that discomfort. And what I found is that if I would have known about these things over the last 15 to 20 years of practice, how many more folks I could have given more quality of life to. Mm-hmm. And, the one gentleman, a guest that comes from a distance, and this is a pretty dramatic improvement that he's had, but history of auto accident and some stuff to the neck during that. Subsequently, he's developed numbness, tingling, discomfort in the hands and the neck. He's had all the evaluation, imaging, orthopedic evaluation. He didn't really want to go the route of an epidural, and he was not a surgical candidate, so he's kind of stuck in this pattern of, some prescriptions that you could take. And so he came in, and we do like we always do. We looked at some labs, looked at the weak spots in his biologic systems, and started to support those. And he started on hyperbaric therapy. I started doing some injections in his wrists, and I could not tell you, wouldn't it be nice to put off surgery? Surgery when needed, again, we're happy it's there because there are times when we need it. But how many carpal tunnel procedures could be delayed if not gotten with ozone injections in the wrist? Mm-hmm. I mean, and they're easy. It's not difficult. The amount of discomfort's there during the little injection for just a few seconds. It boggles my mind. I'm like, wow, versus having an invasive procedure, surgery. If it's me and my wrists, and I can't use the computer or use my fingers. I can't use a pen. I can't turn a screwdriver because that carpal tunnel is so bad. I want to have some options before that, and there are some really good options. So just like this gentleman, we got him going. We did some injections for the wrist and subcutaneously in his neck with some ozone, because his imaging did show there was some inflammation, irritation of that nerve, the spinal cord, the nerve going down the arms. And he started to see some relief with that. And then we added some IV ozone. Again, ozone, it's oxygen, 3 oxygen molecules. It is antimicrobial, so it gets rid of bugs. It increases the efficiency of oxygen utilization. It increases energy. It decreases inflammation. All these things, it stimulates stem cells. So it's not like something that's going in there and is a Band-Aid, so to speak. It's a healing gas. You take a little bit of blood out, an IV blood draw, and infuse it with some ozone gas, and then you infuse it back into the individual for about 45 minutes. And he was in last week. This was after his second IV ozone, and he just was astonished. He's like, I think my neck is feeling better, and I think my hands are starting to feel better. And so it's the combination, he's done some hyperbaric therapy, increased oxygen pressure inside of this that looks like a tent. We have that in the clinic here. Come in, check it out. It's incredible for inflammation and pain. We added in then the injection of the ozone gas, and we made a little bit more progress. And then finally, we added the IV ozone, and we've done a few other things metabolically with him, recommended a few supplements, a few dietary changes, some things to his lifestyle, but he's starting to gain traction now. Mm-hmm. So over the course of the last year since he had this accident, he was feeling pretty despondent, like, I guess this is aging. Again, this is what's going to be. I've had this for a year now. So it's pretty cool to see somebody respond with some techniques that, again, more tools in the tool belt, things that a lot of traditional doctors weren't trained in, like myself, and I wish they were, because more people need these treatments.
Yeah.
But again, you know better, you do better. And one of the biggest things I would say is progress, not perfection. Mm-hmm. And my wife, Carrie, shared that with me yesterday, because we can be kind of hard on ourselves and look at the glass half empty. What haven't I done? What haven't I accomplished? But just focusing on the progress. For instance, I'm going to get Levi in and talk about kettlebells.
Yeah.
Since last November, I've been doing kettlebells, and I wanted to give an update on that. There are some weeks I'm only able to make it there once a week, mm-hmm. but I'm still pretty consistent twice a week. I want to do better, but that's progress for me.
Yeah.
It's not perfection, and I feel better doing it. So that's the thing, we're in this time where there's so many folks that post-COVID are aware now, that are feeling things they didn't feel before. They feel like they've aged, they've got more inflammation, less energy, more brain fog. It's really a time to, when you talk in football terms, to open up the playbook a little bit. Yeah. And I think that's what everybody's wanting. They want to open up the playbook on, let's look outside of all the inside-the-box stuff. Let's implement this outside-the-box stuff. And there's lots of it. And let's go. Let's get going. Let's start.
I think that's the one huge blessing that came out of COVID. There is a large segment of the medical profession that looked in the mirror and just kind of took a deep dive into what they were doing. And I think there's been some incredible results out of that. I think one thing that we talk about all the time is inflammation. We have found how much nutrition plays a role in inflammation. We've found different things in the toolbox, as you like to say, with red light therapy, hyperbarics, ozone. I mean, it is incredible, and it's slowly moving across the nation, and it's pretty cool to see.
It's amazing, and we're just getting started. And that's the thing. There's been so much that, again, when you got some more of the doctors outside of the corporate window that are in a little bit more space of freedom to practice and create and do those things, because we can have longer appointment times and have some time to look back at years past and what doctors used to do and what they used to implement. And extremely powerful. I mean, we've got a new treatment that we've started that it's very, very unique. And it's also been absolutely incredible for neuropathy. It's been incredible. There's always more out there. There's some stuff that may work better than other things for different individuals. And so it's kind of, we try these different things and see what that individual responds to. But, when you've got a lot of options to choose from, we can find some options that are going to definitely help you make progress and feel your best.
All right, so listen, we don't want people to just survive the day. We want them to live the day, enjoy the day. And so if they want to come see you or have one of those discovery calls, how can you make that happen for people?
Yeah, absolutely. Give us a call at 712-339-6024. And it's a 15-minute visit with me to answer any questions, make sure that we're kind of on the same page about moving forward. And because it's a two-way street, the process, it's not me fixing you, it's our team. We've got an incredible team making suggestions, and ultimately it's the individual putting in those reps. So when we talk about that on that discovery call, about the fact that I'm not here just to fix you, I'm here to support you, and I'm here to make recommendations, and I'm here to support you as you work on healing yourself, fixing yourself. And we've got, again, a lot of different approaches, I said, to do that. So that discovery call is incredible. It's complimentary. Then if you would like to schedule an appointment, again, you can call that same number. That first visit's an hour long. And we are just off Highway 71, 3305 Berkwist Avenue in Spirit Lake. We've got a team of amazing people, very blessed with an incredible team. And so you will experience that every time you come in, a team that's happy to be here and believes in the mission.
Absolutely. All right, Dr. Meyer, thank you as always. Love our Wellness Wednesdays. Have a great day, and we'll chat again next week.
All right. Be well, everyone. Take care.
All right. Dr. Bradley Meyer with us from the Okoboji Wellness Clinic. You can just go to okobojiwellnessclinic.com.